nervosa is a serious eating disorder with the highest mortality rate among all psychological disorders. Someone with anorexia will refuse to maintain a body weight at or above a minimally normal weight for their age and height. They will also have an intense fear of gaining weight or becoming fat even though underweight. They will have disturbances in the way in which their body weight or shape is experienced, and in females who have their period, it will stop. Anorexia is more commonly known to affect females. The lifetime prevalence for anorexia among females is 0.9% and 0.3% among males. Males are estimated to make up only 5 to 15% of people suffering from anorexia or bulimia. The typical age for onset is 14 to 19 years old.
Of a song I can't get out. Can I be close to you? Can I be close to you? Can I take you to a moment where the fields are painted gold and the trees are filled with memories?
Anorexia is often diagnosed using the DSM-4 or 5. Strictly, the definition eating disorder applies only to the specific diagnosis anorexia nervosa and bulimia nervosa, both of which require a disturbance of body shape and weight as an essential feature. This strict definition, however, raises the question of when normal dieting ends and eating disorders begin. Some advantages of the DSM, if followed strictly, can eliminate some biases. Also, the DSM gives patients an answer to what they have been dealing with. They may feel relieved their problems are linked to a disorder, or knowing that others suffer from similar symptoms. Some might feel relief in knowing that they are not alone in what they are going through.
So mental disorders are what goes under this category of biological level of analysis, and it is most likely for a person to be diagnosed with eating disorders, and they might have a diagnosis as well of substance abuse, borderline personality disorder, obsessive compulsive disorder, even anxiety disorder. These are very common examples. Striving to be perfect, panicking to eat from that loss of control is a very normal thing to see in eating disorders.
Can I be close to you?
This is in the section of the media. The media has a stigma to have the biggest blame for all of the eating disorders and the higher rank of them. Instagram, Facebook, any sort of media, TV, telephone, they play a factor. And there's a really good study done by Hedgern et al. In 2004, which is called Culture-Bound Disorder in the Western world, and it's about the concepts of beauty and attraction that emphasize to be skinny. And there's obviously fat phobia in everything. There's so many studies done to show this. For example, Strahan et al. Is another example. Stefferin is another example where they put a teacher with students, and then they see how the teacher reacts to a kid that's overweight or not the ideal image of like skinny, and they treat them as lazy and fat and failures just because of the way they look. These issues usually come from the family. For example, when a kid sees their mom stroking their stomach and saying they're fat, and they say, I have to lose weight, kids see that as a goal. They see that, oh, that's an issue, and then they follow in their parents' footsteps. There was a study done by Fairburn et al. Called The Core of Disorders, which specializes in low self-esteem and extreme necessity for self-control, which ties into anxiety disorders and social cognitive level of analysis. This need to be the best and the very best. There's this theory called the schema theory that was done by Darley and another man, and they talk about how we set a certain picture to identify the world, and our picture of success and amazement and magnificence is a skinny man or a skinny woman that's attractive. And then there's that constant wiring in our heads done by the media and the advertising world to do this.
One treatment option is cognitive behavioral therapy. This is based on a theory that how we think about a situation affects how we act, and that in turn our actions can affect how we think and feel. One can also look at group therapy as another form of a treatment option. Group therapy is where a psychologist leads a group of patients, and within that group they talk and discuss about the problems they have. One can also look at family therapy as another treatment option. Family therapy is where the patient's family tries to understand and improve the life of the patient.